Good morning, good afternoon, and good evening to everybody that's tuning in today. I'd like to welcome you all to our Bright Talk event. EC Council has gone ahead and asked me to present a little bit at my leisure what I thought would be interesting. And I figured since healthcare affects everybody, it would be an interesting starting point for our first presentation together. I'd like to just explain my title here, healthcare security, IT stinks. Listen, this isn't done intentionally, but it's also not prevented, and we're going to go through a little bit of why it's healthcare and why it stinks. So who am I? My name is Christos Simotas. I'm an ethical hacker. I'm here to help. What is an ethical hacker? Well, it's people who study hacking, practice hacking, and then we hack stuff. Only to test the defenses of the systems, of course, and only in improved circumstances. Now, the reason I'm presenting healthcare is because last year I was nominated to sit on Canada's Scientific Advisory Committee on Digital Health Technologies. And we were asked to provide ongoing medical, technical, and scientific advice, basically for regulatory issues for drugs, medical devices. And the findings that we had were not only startling to us, but were also startling to some of the people that sat on the board. And I'd like to go over some of those findings with you guys. So today's agenda is pretty simple. We have an introduction to healthcare, medical devices, going to show some push-to-kill stuff, smart-ish hospitals, the Internet of Medical Devices and what's on the way in the future. Ransomware, of course, we all had our nose in that, I'm assuming. Pager systems, healthcare cybersecurity costs, and, of course, the need for a real solution. So, if there isn't any questions, I'd like to go ahead and get started. So let's start with some statistics. Let's look historically what's been going on. People that were working inside the healthcare industry were responsible for 192 health breach incidents. It took an average of 233 days for them to discover that they had been breached. Because of the advancements in technology, we're kind of seeing different warfare now with SQL injections, full data dumps, database clones with everyone's healthcare records in there, the advanced persistent threats to get to new clients, zero-day attacks, and all of the ransomware, and of course, the advanced malware. Now, this doesn't really mean much of anything to anybody until we start putting faces to stuff, which we will about halfway through this presentation. We face a number of threats in the IT community, let alone in the healthcare community. HSS reported 106 hacking incidents just in 2016, and this was more than double the number of 2015, and this has increased and increased and increased. Hackers see information such as addresses, social security numbers, credit card numbers, and this is what lets them do their identity fraud and get rich off of your information. The Breach Barometer report, in 2016, we averaged at least one health data breach per day. That affected more than 27 million patient records just in the United States alone. Now, when we're talking about medical devices, we have defibrillators, we have heart monitors, we have pacemakers, we have insulin injectors, and this is just some of the stuff that's been hijacked and breached. What we're looking at in the future is more of this being our modern day hospital rooms. We are surrounded with technology devices. We are surrounded by network devices. We are surrounded by operating systems and firmwares, and they're breachable. So let's look a little bit at the history of the medical devices. We've seen different purposes. They contain configurable embedded computer systems. They're increasingly interconnected. They have wireless connectivity, and unfortunately, some of them are running legacy. And Its use environment is that which you would expect, varied responsibilities for purchase, installation, and maintenance of medical devices. What does that mean? It means that once you get it in your body, it's up to you to show up for your upgrade and your update. Variable control over what is placed on the network. Most of the stuff that goes in and out of these devices, especially heart monitors, is clear text. Inconsistent training and education on security risks. I mean, a nurse or a doctor should not also have to have a technical degree in networking to install health monitoring equipment on a patient. Now, the risks that we've encountered here, we have network-connected medical devices infected or disabled by malware. We have malware on hospital computers, smartphones, tablets, other wireless mobile devices, even the implanted patient devices. Uncontrolled distribution of passwords. I'm sure somebody on the call has unfortunately shared their password with somebody for one purpose or another. Failure to provide timely security software updates and patches. So I've worked with a handful of hospitals in North America, and the reasoning behind this is, well, we just don't have the staff, and we don't have the budget, and we don't have the support, and who's left at risk after. Security vulnerabilities in off-the-shelf software designed to prevent unauthorized device or network access. We'll see an interesting case of this in a little bit. So why are we focusing on medical device security in the first place? So let's have a quick look here. In 2008, the pacemaker got hacked by Kevin Fu. You can all understand the weight of a pacemaker being hacked. In 2011, an insulin pump was hacked. Now, when I say hacked, I'm not saying that they took these apart and they attached things to them and then they put them back into people. No, these are remote hacks. These are things that are done from a distance. In 2013, there was a discovery of a wide range of vulnerabilities, including surgical and anesthesia devices, ventilators, infusion pumps, defibrillators, patient monitors, and laboratory equipment. Now, whoever's on this call, if you're ever in a hospital room, knock on wood and God forbid, but should you have been put in one of the rooms where all of these devices have been breached, I don't think your level of trust will be as high given the situation. And this is why we've had so much attention on this. There's a gentleman named Barnaby Jack. He is a white hat hacker from McAfee. This gentleman hacked an insulin pump, delivering 300 units of insulin to a mannequin in a matter of seconds. They figured out how to do this from up to 500 feet away. Now, this is terrifying. So what's worse than the devices being hacked is the guidance that we are being given from the governing industries. So let's have a look here. The cybersecurity vulnerabilities of the Hopira infusion system, the FDA had a safety communication July 31st, 2015. The headline read the remote ability to control an infusion pump. The FDA's response was that they strongly encourage the healthcare facilities transition to alternate infusion pumps and discontinue the use of these pumps. They weren't banned. They were just strongly encouraged to change them. This isn't safe for anybody. This is not the responses that we're expecting from government agencies when it comes to our health. Now, if we look at a very low-cost smart hospital, something that's very near into the future, we can see a lot of IT devices connected, remote care systems, identification systems, networking equipment, interconnected clinical information systems, mobile client devices, even the buildings themselves with networked medical devices, and of course all this data. Now, seeing the history of the breaches that have happened in the last 15 years, moving to a smart hospital and having all of these digital assets available without the right security mindset in place, this is a very dangerous future that we're moving into. this is more of the hospital room of tomorrow. Now, as we can look through some of these slides here, some of these points, we have smart pills, we have ultrasounds from the cell phone, we have memory replacement, we have all kinds of things that are working heavily with interconnected devices and cloud systems and storage and A to Z from networking. Okay. The problem with most of this is that it still hasn't been tested, but it is being released. Let's look a little at a mind map and add a little section here that didn't exist. So we've seen natural phenomena, we've seen supply chain failures, we've seen human resource errors, we've even seen malicious actions. But now we're starting to observe system failures. Now, this is something that didn't exist in the 40s, in the 50s, in the 60s, maybe even in the 70s in hospitals. But now that the devices of interconnectivity have gone outside of the horizon of our organization and into the cloud, we rely heavily on things being available. The vulnerabilities of smart hospitals, there's quite a few of them. And these have not really been addressed in a way that is 100% compliant, let's just say. They're just band-aid solutions. I'll read through a few of these here, but lack of proper configuration, users' behaviors, impossible to virtually patch all the devices, the lifespan of medical devices. I mean, you're not going to buy an MRI machine every year. Little malware detection, no clear way to alert the user when a security problem arises, usability issues causing circumvention of set policies. The biggest of all of the threats, I think, is that one. The lack of compliance with organization or industry standards. I mean, the list can go on and on and on. And if these are not addressed and taken seriously, one of these days it might be us in this hospital room, right? So let's look at some attack scenarios so that we could really understand how easy some of these things are, right? And looking through this list of the top 5, we have our social engineering attacks. We have our medical device tampering, which is, you know, the lovers of engineering will reverse engineer medical devices and look for threats. Not malicious in itself. Most of the time it's reported so that people can do something about it. But even then, by the time it's reported to the time something is done, sometimes it takes a year or two. Then we have the ransomware attacks on the hospital information systems, and of course, a denial of service on hospital servers, which is detrimental to anybody. Based on what we've seen, I can say that these are the attack scenarios that we're aware of. Given the new medical technologies emerging, the future attacks can only be predicted. The Internet of Medical Devices is an interesting phenomenon that's coming around now because we have 20,000 medical device manufacturers, resellers, and distributors worldwide selling stuff that is breachable. The average number of devices around the bed is around 17 now, and 1 of 4 of these devices are networked. The healthcare industry spends about 5% of IT budget on security. Financial institutions average around 15%. That number doesn't seem correct to me. So theoretically speaking, let's look at a use case. Let's say that there's a patient and malware has infected one of the diagnostic medical devices. Now, what do we do here? Do we unplug the device and kill the patient to save the network? Or do we keep the device online and allow the rest of the network to get infected in order to not kill the patient? This decision of leave it up or shut it down, this risk assessment is patient safety paramount. It can't be It can't be discussed on the spot. There needs to be a protocol and procedure, yet we don't plan for these things to happen. Hence, there is no protocol or procedure yet, at least not in most of the places I have visited. Now, there's a reason healthcare is in the crosshairs. Let's look at these examples over here. We have Hollywood Presbyterian, MedStar, Kentucky, Methodist Hospital, Chino Valley Medical Center, the Desert Valley Hospital, the Alvarado Hospital, and the King's Daughter Health. These people were under ransomware attacks. Over 75% of organizations that were audited in the Healthcare IT Newsweek survey of hospitals had had at least one malware attack in the last 12 months. Let's see what this results in. So, the Methodist Hospital in Kentucky declared a state of emergency. It shut down all the workstations in the hospital. The attacker demanded $1,600, 4 bitcoins at the time. The hospital was forced to go back to paper for 5 days. I don't know if any of you work in the healthcare industry, but this is a nightmare. The Hollywood Presbyterian Medical Center paid $17,000 to get access back to its data. Systems were down for 10 days. They went back to paper also. Some patients were, quote unquote, redirected to other hospitals. The Kansas Heart Hospital paid its ransom, didn't even get its decryption keys back. Malware authors demanded a second payment. The hospital refused to pay the second ransom. They have not yet recovered. These are detrimental. These are unallowable things. These are beyond what is acceptable in our healthcare industry. As you could see, the top product that every healthcare organization has is an antivirus, followed by webmail security, firewall, and a VPN. Now, we think to ourselves, an antivirus, and we assume an antivirus is there to protect us. Let's look at an example of how an antivirus overstepped its boundaries. Most of cybersecurity is making a system robust to the unknown or to the unexpected. Malice is not always a prerequisite for harm. In early 2015, a medical device used during a heart procedure became unresponsive. The forensics showed the antivirus installed in the device started to run and consumed all the processes while the heart procedure was taking place. Although the antivirus's sole purpose is to protect systems from malicious activity, it in itself did something malicious. No malice was intended. Now, I've worked with many hospitals, and whether it's an ultrasound machine, or whether it's a heart machine, or whether it's an eye exam machine, mid-patient, these machines start to run antivirus scans, and then the entire procedure that the patient went through has become useless. They have to come back, they have to do it over. In this case, it happened to be somebody's heart. Luckily, the doctors were able to get the medical device back up and running and finish the surgery. Look at another fun example. More innocent. In 2014, a nurse plugged her cell phone into a USB port on an anesthesia machine to charge her phone. I know this sounds ridiculous to you. I know many people in the healthcare industry that do this on a daily. This particular machine chose to shut down. There was no malice from the nurse. She was just looking to charge her phone. After all, availability in a hospital is very important. Malice is not always a prerequisite for harm. So the POXAC devices, these are pager systems. Our pager users before consisted of basically everybody. Our pager users today are usually medical professionals, emergency response, police, ambulance, security patrol, courier drivers, and system administrators. Now, the reason we're still using these pagers is because texts can take hours to deliver. Sometimes they don't even make it. Now, the advantages of a pager over text is, of course, the availability and the immediate delivery. So when you're dealing with an emergency, you want to make sure that your emergency response team is notified immediately. Now, hobbyists like ham radio, people that track trains, fire, etc., usually listening to this stuff. The problem is, who else is listening? So stalkers, towing companies, private investigators, journalists, black hat hackers, and security consultants are amongst the groups of people that are spying into these devices. Now, the reason they're able to is because there is no pager security. Pagers weren't designed with security in the 50s when they were created, and they haven't had new protocols issued ever since. So the messages are sent one way across a large geographic area, and if you have the right equipment, you can decode these live as they're being sent. So these are the pager frequencies that exist in North America for hospitals and medical. You can tune into these with a software-defined radio. Now, a software-defined radio is traditional hardware implemented into software. It enables for easy signal processing and cheap wideband scanner radios to be produced. Now, I understand this might be a little bit odd, but let's look at quickly this signal of a POCSAG pager. This is what would come through the frequency. Now, the cost of this depends. Some are $23, some are $25, some are $29. But the cost can easily go up to the hundreds of dollars for the more in-tune equipment. So the difference being the cheaper stuff will go up to 900 megahertz. The mid-range price will go up to around 2.4 gigahertz. And the very expensive stuff is basically limitless as far as your budget is concerned. So the question is, can we decode this stuff with this cheap little radio? And the answer is yes, we can. Now, I wanted to show a live demonstration of this decoding taking place. After checking with law officials, my government in Canada, unfortunately, does not allow sharing decoding information on a live broadcast stream. If you were all here in the room, I would be able to. Unfortunately, because this is being broadcast globally, I do not have permission to be decoding patient data live on the screen for everybody to see, but I can explain to you what kind of stuff is going through this. So POCSAG pager frequencies come in every second or so, and the messages include patient names, patient records, what the patient is suffering from, the injection the patient might be needing, the pills the patient might be needing, the patient's folio number, the patient's room number, their doctor's name, amongst other weird things that go in there, calling janitors for room cleanups, doors opening, server backups, SQL database, backups completion. There's a lot of information that goes through these things. It's odd to see all of this going through clear text because clearly this isn't compliant with any government standards as far as Information Privacy Protection Acts are concerned, yet still till today, we continue to use these pagers in clear text transmitting patient data to anybody that's there to read it. 2020. Technology from 1959. So again, my sincerest apologies. I will not be able to fulfill the demonstration, but I will move on to a more interesting point. What are we paying to protect exactly? Well, those of you that are in North America, since 2005, There's been 268 million records breached. There's only 327 million Americans. What are we paying to protect exactly? Stolen credit cards sell on the deep web for as little as $2. Stolen medical records can range from anywhere from $10 to $20. Here's where it gets interesting. Your credit card could be canceled. Your electronic healthcare record includes your credit card, your address, your social security number or your social insurance number, your current employer, and your current insurance information. So as a criminal, now you could order new credit cards, take out bank loans, and get access to high-priced narcotics on your medical insurance. And that's why your credit card is on your electronic health card record, because of your narcotics. The total theoretical cost from sales of these 268 million records that were breached is only about $5 billion. The total from fraud is unknown. It's only estimated. Not accurate. So we've seen solutions, and all of the solutions involve basically throwing money at it. And this isn't going to solve it. So let's see what this means. Based on the current analysis, the global healthcare cybersecurity market was valued at $7 billion in 2018. It's expected to reach $27 billion by 2026, according to the CAGR. It's a growing concern in healthcare. So what do I mean by throw money at it? Well, let's see. This is what's been implemented globally across the hospital systems as far as the up-to-date hospitals are concerned. We can see literally columns of money. Technology, strategy, and operations, hundreds of thousands. Security, cybersecurity, informational security, millions. Risk management, compliance, and frameworks. I mean, okay, so you get hacked, you defy HIPAA, then you get charged a fine, and this makes things okay. I don't agree with this. So what I'd like to end with here, I'm not sure if we're able to have an open discussion or not on this platform, but what I'd like to leave you with is the following statement. The companies that have created our systems that we have at home, that we have in our office, that we have everywhere in the world, Microsoft, Unix, Linux, Apple, Google, these companies were created for profit. They weren't created for hospitals, they weren't created for banks, they weren't created for governments, they were made for profit. When the IEEE created the internet originally, they created it because they were tired of walking around SneakerNet and delivering files back and forth. It was thought of as a solution. My impossible solution to this would be for a group of individuals, like we had Bill Gates in the past build an operating system, like we had Linus Torvalds in the past build another operating system, and amongst others, we need a gathering of people that are bright and that are encouraged to start offering solutions as far as recreating and reinventing, because unfortunately, we've seen for the last 25 years, the current systems don't work to protect our privacy needs. They don't protect to work against our corporate needs, against our banking needs, against any kind of need. Everything has been breached. Thanks for tuning in.